be having a look at some areas of the scalp, particularly around the hairline and some areas of mid-scalp, kind of at the crown. Perform some mild tugging at the skin. Just kind of having a look here. So, getting started with your assessment today, Samita, I'm going to be performing a few kind of passive examinations. I just want to have a look at the overall health and well-being of your skin as well as your scalp, and just having a look over a few areas in particular. I do like to focus a bit on the ear and then maybe some bits of the forehead here, and you can let me know if there's anything specific that you're concerned about, or if I palpate anything that feels particularly tender. Of course, you're welcome to let me know. For the most part, I'd like you to just relax and try to lie still so that I can perform my examination accordingly. Okay. Alright. So I am going to go ahead and get started. Now, for the first part of the exam, I will be using my pen light, and I do want to warn you, it is fairly bright. So for this portion, at least, I would like you to keep your eyes closed so I don't accidentally shine it directly in your eyes. And I'm just going to start by having a bit of a visual inspection. So I like to start here, kind of in line with the neck, and then visualizing just at the ear, looking for any areas of concern there. As I come up towards the temple, I'm looking for any signs of inflammation, anything that looks of particular concern, and then carrying around just at the very base of the hairline. I want to look for any flakiness or any areas of dry skin, redness of the scalp, any signs of hair loss. So I'm just going to turn your head very slightly this way. Having a look at the temporal region on the right side as well. Nothing particularly notable there. Just going to expose the ear. And then as I look at the face and the overall complexion, skin texture, skin color, looking for any signs of sun damage or any dark spots, any patchiness or signs of dermatological concerns. You don't see any flaking or redness anywhere. Skin appears well moisturized, nice and hydrated, cheeks are plump, no signs of active breakouts, your lips are very well moisturized. It's an area that I tend to see overlooked, and it does appear nice and healthy. I have a small brush here. I'm just going to have a look at the brow. I like to look directly at the follicle. Gentle manipulation in the opposite direction, just looking for any signs of sparseness. Particularly at the tail, I do tend to find some breakage of the brow, and that's not notable there. Very good. So again, I'm just going to have a look at the other side. So I always like to check for any difference particularly notable here either. Hair is intact. Tail is nice. And then if I look at the lashes on the right side, nice and clean. Signs of excessive oil production of the lash line and no spurs missing. So going in with our second part of your examination, Samita, I have some just kind of metal sticks that I like to use for sectioning of the scalp. So we'll be having a look at some areas of the scalp, particularly around the hairline and some areas of mid-scalp, kind of at the crown. So I'm just going to section just a few places here and look for any redness or flaking of the skin, any signs of buildup as well, either from product or just excess oil production. Sometimes the gland here and the pores can produce a little bit excess oil, so just having a brief look. Of course, also looking for any signs of infestation, either from lice or any sort of mites. Nothing that suggests that here. Hair is nice and clean, appears very well groomed. Just gonna have a look at the part here. Do you tend to part your hair in the middle? Yes. Okay. So I do like to pay attention to areas that either part naturally or are parted by preference. So you tend to see some signs of sun damage here where the scalp is not quite as protected by the hair. So just having a look here at the scalp, and that does look okay. I don't see any blistering or any abnormal discoloration. So just something to be mindful of if you're ever spending extended periods of time in the sun. Overall, your scalp is very clear, nice and healthy. Just gonna look at a couple different areas here. So I have a tool here that is going to produce a very gentle puff of air along the skin and the scalp, and this just helps to dislodge any particles that could be stuck on the surface of the skin and visualize any areas of particular dryness, which is not notable. I don't see any flaking upon manipulation. Kind of gently irritating the scalp, seeing if anything dislodges, but so far there's nothing notable. So just a couple different areas I like to vary and just have a look. I'm sure there's nothing I'm missing, but I don't really see anything. Very small red mark here. It does just look like normal variant in skin texture. Alright, so just going to gather a very small section of your hair here. So the last part of this scalp inspection, I like to just have a look at the hair itself. So I just have a comb. I'm going to very gently comb through the length of the hair. Have a look at the integrity of the hair shaft. Very mild, gentle tugging at the follicle, looking for any weakening, any breakage. Nice and strong. the length of the hair. Your hair is very long. Don't notice any excess breakage at the ends. Doesn't appear to be any gumminess or like a protein there. It's very good. So I'm just going to feel as well with my hands directly against the cranium, feeling for any signs of swelling or any abnormality, any abnormal nodules, any lumps or bumps, sensitive spots, soft spots. I don't feel any signs of swelling. Just kind of flat hand in motion here, feeling good. Just gonna a very mild pressure. Just going to move into some palpation of the overall head and neck area. So I'm feeling with my fingers, soft circular motions, just palpating along different areas. Directly behind the ear. Pumping motion here. I'm just going to feel the ears itself, and I will say that your ears are just slightly cold to the touch, so maybe just mild lack of circulation here, but certainly nothing I would say is concerning. And as I feel along the jaw, for any areas of swelling, so palpate along the temporal region. Just let me know if any of this causes you any pain. Come directly along the brow bone. Just very gentle pinching of the brow itself, looking for any signs of inflammation, any pockets of fluid. And then I'm going to touch just very gently directly underneath the eyes. Just keep your eyes closed for me. I know this can be just a little bit ticklish. Directly off the eyelids. Sometimes if there's an excess in sinus pressure, this can feel a bit uncomfortable. So you just let me know. Come and palpate kind of directly along. Just gonna look at the texture of the skin, looking for any textural abnormalities, any roughness, bumpy. Overall texture of the skin is very smooth, nice and supple, and fairly even throughout. Of course, there's always natural variation, but for the most part, your skin is very healthy. Just going to very gently palpate here at the neckline. Very soft, flat-handed motion. I'm just feeling for any swelling. Just going to do the same thing on the other side. So just feeling around. Feel any abnormality there either. Just a second Prior to that, I'm going to go in and take a couple of measurements. So these are really just face measurements. I just want to see, excuse me, I'm so sorry. Just want to see if there's any areas of concern here. Mostly checking for symmetry with the face itself. So about 10 inches. If I measure bilateral length of the face, laterally about 7 inches. I like to measure your face in like sections. So I'm going to go corner of the eye to the forehead. We are 3¼ there. And then if we do base of the nose to corner of the eye, we're right about 2¼ And then lastly, measuring from your chin to the base of your nose, we're right about 3 inches. So your face is fairly symmetrical. I would say the midsection of your face, nose to eye, is slightly smaller, just a little more narrow. And the top and bottom are fairly equal, so just gives you a bit of an idea of the overall face shape. And then if I do and I'm going to come up and do stroke over the eye, right about 1¾ inch there on the left side. And very even there, so nice and symmetrical with the eye socket. And lastly, for measurements, I like to go in with my ruler, and I'm just going to measure right at the center of the face. So we're measuring vertically to start with. And if I use my marker here, let's see. So that is right at the center of the nose, and then very nice actually. Your nose is right in line with the forehead and chin. There's very good. And then if I come horizontally and measure again, so we'll use your ears as our nice and so I also just like to do diagonal symmetry, which is also so I'm just gonna come in here again, measuring directly over the brow bone. And I would say so I'm going to come in with a tool that, just to give you a bit of a warning, it is very cold, so you're going to feel a very cold sensation. I'm just going to gently manipulate your skin. I'm just going to move this across the surface of the skin, and you don't have to do anything. I'm just measuring for any signs of inflammation. This device will give me an audible indication if there are any areas that are particularly inflamed. So far, nothing is notable. So I'm just going to come down the forehead to the ear. Good. And then follow that down here parallel to the thyroid. Nothing here as well. Then if we come back towards the ear. Same thing on this side. I'm just going to put her starting at the forehead. I'm going to stop just at the ear. Down. Back up. Just another look here. Just want to see. Don't think I'm seeing any variation there, so it looks really good. Overall, just a few freckles, the face, nothing that appears concerning. Slightly raised above the surface of the skin, but overall very symmetric in shape. Nice and round edges. The color is even. It's very important to ensure that you're wearing adequate sun protection. Even just 15 minutes or so in the sun can increase risk for skin cancer, so just something to be mindful of. So coming up at the top of the scalp, I just want to pay a little bit more attention here. So I'm going to do some just mild manipulation at the follicle. You're going to feel a very gentle tugging. I'm not pulling, I'm just very mild, kind of intricate manipulation here. Feeling for any areas of weakness, any areas of concern at the scalp, the hair. Mild tugging. Just like to take smaller sections. Also noticing change in texture of the forehead as I pull the skin taut. And then if I take larger sections, I'm just kind of gently manipulate back and forth. Just going to go in with a Q-tip here, and it's just kind of elongated to allow me more room for movement. I'm just going to manipulate at the hairline, move my way into the skin, perform some mild tugging at the skin. I like to test for skin turgor, any abnormality or diminution of elasticity, collagen production. As a whole, your skin is well hydrated, nice and plump, very good return. apply a gentle pressure in different areas and then watch for how long it takes the skin to return to its original position. I'm not seeing any delay here. And just doing a gentle check for reactivity. Several very sensitive nerves around your eyes, and even when your eyes are closed, any sensory stimulation can cause that kind of micro movements, specifically along the brow line, in between the brows, just at the eyelids. I do see very natural reactivity there. Same thing, testing for reactivity, this time with a very gentle kind of brushing motion. Gentle outward motions towards the temporal region. Looking for any micro variations, just kind of differences bilaterally. Go in and do some final gentle palpations of the area as a whole. Just using a flat-handed motion. I just want to feel for any possible concerns I could have missed with my initial exam. Also just going to bring that palpation along the upper body. I want to feel at the shoulder for any areas of tension. So we do tend to hold a lot of tension here at the upper body, so I'm just going to apply some gentle pressure. Just a little bit of tightness there. Just apply it to increase the pressure. Bilateral pressure just at the clavicular line, so holding at the top and bottom. Circular movements there. I do feel just a little bit of pressure. Just kind of having a look here. Directly behind the ears. some last final few visualizations. I'm going to go ahead and close out your examination today. Now, I would like to say that as a whole, your body does appear to be fairly well. Now, I did feel some areas of excess tension here just at the shoulder, so I'm not sure if that's more physical stress or if you've had heavier mental load lately, but I do feel just a little bit of overall tension and warmth here. And then maybe some mild pressure buildup just below the ears. So obviously recommend trying to get a good night's sleep whenever possible, ensuring that you stay hydrated. Skin is in good health overall. I didn't notice any excess in sun damage or any flakiness of the scalp, any sparseness of the brows. Everything as a whole looked very well. The only recommendation would be to try to reduce stress, which sometimes is easier said than done. Otherwise, I think we can finalize your exam today, and I would like to see you back in the future for a bit of a reassessment.
Thank you so much.
Absolutely. Thank you for coming in. I will allow you a few minutes, and you are welcome to head towards the receptionist desk to check out whenever